Liz Dunleavy began the Kith Elder Care practice in 2015 after having spent several years working for other care management agencies. She received her master's degree in social work from Fordham University with an emphasis in gerontology in 2000. Since then, she's worked to provide care and advocacy to the older population. She is a member of the National Association of Social Workers and Aging Life Care Association. Liz has served on the board of the Aging Life Care Association's Mid-Atlantic chapter and is a former co-chair of the ALCA Philadelphia unit. When not helping clients, Liz enjoys spending time with her son, her new puppy, and gardening. And Liz, we're very, very excited to have you. Thank you so much for coming today, and I'm going to hand it over to you.
Thank you for having me. So, hello, everyone. I just put my puppy in the, she's no longer a puppy, but in the, in her crate, so she might be whining if you can hear the other. So thank you again, Allison, for having me. As Allison mentioned, my name is Liz. I'm a geriatric social worker, and I'm going to talk a bit today about home care considerations, kind of the various types of home care that we work with, some considerations when choosing what the best option would be for you, and then kind of what to do once you have home care in place, how to help manage home care and troubleshoot as things go along. So there are various types of home care options out there. The first one that comes to mind is informal caregivers, and many of you may be fulfilling that role where friends, family, or volunteers are helping out those who need care, typically for free, and typically while they're juggling multiple other responsibilities like child care or job. I was looking online, and I thought some interesting statistics. So a study that was conducted by the National Caregiver Alliance said that about 34.2 million Americans provide unpaid care to an adult age 50 or older. This was done back in 2015, so I assume the numbers are much higher. And then a more recent study indicates that about 16.7 million adult family caregivers are caring for somebody who has Alzheimer's disease or another type of dementia. So those are large numbers. And again, this type of care is typically not paid for. Often these people are in the sandwich generation, or where they're juggling all different types of things. So we have worked with some families or individuals who have had to take Family Medical Leave Act because they are not able to fulfill the role of caregiver. There's a lot of times resentment amongst children or family members if somebody feels that they're carrying more of the burden of care than others, or if they don't really see the needs in the situation eye to eye. So a lot of times we will help with mediation and kind of working through those issues. So that's informal care. And another type of care, which is probably the most common, is home care agencies. So that would be a licensed home care agency that you would contract with to hire a caregiver. Since COVID, we've seen a lot of changes in the home care industry. We used to be able to have clients receive 2 hours of care. Caregivers would go out for 2 hours, leave. Now agencies won't even take a case if it's 4 hours. They're telling us 6 hours or more. So it can be challenging to find those smaller hours of care that a lot of people need. So typically now it's 4 hours of care, 4 to 6 hours of care that an agency wants before they would have a caregiver go into the home. Caregivers are not always, they're usually either certified nursing assistants or home health aides, but there are caregivers who do not have any formal education or training in caregiving, but they are able to work through an agency as a companion. So caregivers can help with, I'm sure you've all heard, the activities of daily living, bathing, dressing, grooming. So they can help families, by providing those needs. In addition, they could, prepare meals, they can do light housekeeping, they can do laundry, they can run errands, they can take clients to appointments. medication reminders. They're not able to administer or touch the medications, but they can do med reminders. So, these folks can be, a great help. The average hourly rate we're seeing right now for these types of caregivers is $28 to $35 per hour. And I tell families too, sometimes when they're needing extra care or longer hours, that overtime comes into play. So if a caregiver works more than a 40-hour work week, the family will be charged overtime for that individual. And even if the caregiver is on another client, so maybe they're not working for the individual for 40 hours, but they're helping another client within the agency, and their sum total of hours for the week exceeds 40 hours, there will be overtime. So that's just something to be aware of. I think an important thing too with the shorter shifts we find is continuity of caregiver. So there are, it's kind of the Wild West sometimes. If a caregiver gets a job that is more attractive, maybe has more hours or is closer to their home, we've seen quite often they've shifted midstream. So the family thinks they have a system in place, they have care in place, and they discover the caregiver is no longer available or has accepted another position. That can be avoided sometimes with the other option, which is a live-in caregiver. So again, most of the live-in caregivers that we work with are through an agency. The agency vets them. And I should go back. So with the home care agency, when you have an individual coming into your home, the agency is supposed to do background checks, criminal background checks. You want to ask the agency if they do national and federal checks. They will do if the caregiver's driving, run their driver's license. The caregiver is bonded, so if something goes missing in the home, you have some recourse through the agency. The agency also carries workers' compensation. So if a client gets hurt on the job, it's not going to be your responsibility. It would be the agency who would handle any workers' comp claims or that nature. So live-in caregivers are just that. They live in an individual's home. They, by law, are supposed to have 8 hours of uninterrupted sleep. They're supposed to have private sleeping quarters, and they're entitled to some breaks during the day. But this option helps minimize if someone's really concerned about call outs. Maybe a family member doesn't live nearby or work, so they don't want to have to worry, like, gee, is the caregiver going to show up? If with a live-in caregiver, someone's car is not going to break down, they're in the home, which can be good and bad, but they're there. You tend to get more hours for your dollar with a live-in caregiver. So live-in caregivers, the daily rate is between $350 to $395. That's what we've seen. Families are expected to provide the caregiver with food. So that's usually either a meal stipend, or the family, if they're ordering groceries, might just, add on whatever the caregiver wants to the grocery list. So I mentioned that they're supposed to have 8 hours of uninterrupted sleep, have some breaks throughout the day, and private sleeping quarters. This is great if somebody's sleeping through the night, right? But if, quite often, especially with, memory impairment, an individual can be disoriented and be up a lot during the evening. So a lot of times, again, it's still cheaper if you have a live-in caregiver, and then you have an overnight awake caregiver come in and work the overnight shift. So they are awake care. The live-in caregiver can get their 8 hours of uninterrupted sleep. The other caregiver is alert and available for the individual if they're not sleeping through the night. And this tends to be a cheaper option than having around-the-clock awake care, doing the home care route. The live-in caregivers that we work with, some kind of move into the home and they will stay there, for months and until they need a break. Other agencies are, have a split where maybe the caregivers, there's 2 live-in caregivers, so it would be like a 4-3 split where one caregiver is working 4 days, another comes in for 3 days. Or, someone works Monday through Friday and somebody does a weekend. So I think there's pros and cons about both of those options, but, those are the kind of either the live-in and stay-in option, and then the split live-in option is what we see. Another option for care is a registry. I think of this more like a clearinghouse. So registries do some vetting. They're supposed to make sure that people's certification is they have what they say they have. They do background checks on the individuals, and then they match the individual or the client with the caregiver, and then the caregiver is the client's responsibility. So if a family were to hire somebody through a registry, they're responsible for paying them directly. They're supposed to do all the withholdings for that individual. They also pay the registry a small, usually monthly fee, for kind of like a finder's fee. And there's a little more flexibility with a registry, I think, because that you have between the caregiver working out schedules between the caregiver and the client. We've had cases where caregivers through registries have been willing to do those shorter hours. So they will work for 2 or 3 hours. Maybe they have a case nearby and they'll pick up shorter shifts. Registry care tends to range between $19 to $24 an hour. So it's a much more affordable option than a home care agency. But the downside is you don't have the workers' comp, they're not bonded. So if something happened to a caregiver who you hired through a registry, you would be, as their employer, technically responsible for any medical bills or anything related to a on-the-job injury. But what people do quite often, if they're going this route or if they're hiring private caregivers, they will look at their insurance policies to see if they can have a rider or if there's coverage for in-home care. So the other option we see often too is the private caregiver, where that's somebody that maybe a family member finds online or through networks, and they hire them directly. So there's advantages and disadvantages. We have a case right now where the gentleman has a wife who is insulin dependent, and caregivers through an agency are not allowed to administer medications. This woman needs insulin 4 times a day, and she cannot administer it on her own. So we had to work to find a private caregiver. So this person is a certified nursing assistant, but she's working for herself and reporting directly to the husband, so she can administer the insulin. So that was a workaround we were able to have, and that's been successful so far. We find a lot of our private caregivers using the care.com website. And we've had success for the most part in finding decent caregivers, that are qualified. A lot of them have had agency experience, but they prefer to work on their own because more of the money goes in their pocket. So we've in instances where somebody might have a need that an agency caregiver is not able to meet, we would go the private caregiver route for our clients. If somebody is really looking to stretch a dollar, we have folks that have very limited. I mean, caregiver, it's expensive, right, to hire caregivers. So adult day programs sometimes help fill hours, and that's where an adult day program is usually geared towards individuals. A lot of folks there will have some form of memory impairment. There's 2 types of adult day programs. There's the social model and the medical model. Most of our clients that use adult day are in the medical model. And the benefit of the medical model is there is a nurse on staff. There's nurses on staff. They can administer medication. So if somebody has a med that they need to take during the afternoon while they're at the adult day center, they can. They can assist with showers. You know, if somebody's refusing to shower, if that's a real challenge in the home, the staff at the adult day sometimes are able to accomplish that. They provide socialization, trips, meals during adult day. And that we're seeing is usually like $80 to $100. It may have gone up a bit more since COVID, but those were the ranges that we were seeing pre-COVID. Transportation varies. You can usually arrange for your loved one to be picked up from your home and dropped off, but that is usually a separate expense. And then there's usually a minimum number of days that adult day programs like to have their participants attend the programs. So if someone's looking to stretch the dollar or maybe work during the day, an adult day program sometimes is a nice option. So they know that their loved one is looked after, taken care of. They can do what they need to do, you know, at work, attend their own medical appointments. And then at night, you know, maybe be the caregiver, or that might be where they bring in an overnight caregiver, you know, if the situation requires. Unfortunately, Medicare does not cover any home care, any long-term home care. So again, this can get very expensive. If people are fortunate enough to have long-term care insurance, quite often that they will cover, the policies will cover a portion of the home care, as long as that individual or individuals meets the criteria that's specified in the policy. If someone is eligible for the Medicaid waiver program or options program that the state of Pennsylvania offers, they may get some subsidized home care through a Medicaid participant, home care agency that participates in the waiver program. I've never seen it where somebody gets around the clock care though. So usually, you know, you get shifts of say 6 to 8 hours, and the family is expected to kind of piece the rest of the care together if somebody needs, you know, more comprehensive care. Some VA benefits, if someone's a veteran or a spouse of a veteran, they may qualify for some aid and attendance benefit that can provide some monies for home care. But for the most part, it's an out-of-pocket expense. So I have, I told Allison I have 2 checklists, and I can share them with the group later if people are interested, but we have a private caregiver checklist. So questions to ask if you're opting to hire a private caregiver, not through an agency, and then a list of questions to ask if you are interviewing home care agencies. So, you know, we over the years, I've worked with a lot of different home care agencies, and I feel like you can have a really good home care agency and then a bad caregiver, or sometimes you luck out and you get a great caregiver and a not so good home care agency. What I like when I'm looking for working with a home care agency, I don't want them to just send out a warm body. So I really want a relationship. I want to know who my contact person is at the agency. So if something isn't going right, or I have a question, I can pick up the phone, not put on hold or shuffled around. Like, I'm speaking to somebody who knows my family, knows the situation, and can help resolve any issues that come up. I like to see oversight. I don't want an agency just to send out a caregiver and say, job is done, we'll send you the bill. I expect the agencies that we work with to check in periodically on our clients to really work if it's not a good fit. And I tell people it's like dating, like you're not always, you're gonna hit it off with the first caregiver that comes in the house. So I had one client, we went through, I think 16 or 17 caregivers. She was a tough cookie. But we finally found, I think it was in part that we found the right balance. We found the right caregiver and we found the right agency. And then That caregiver was a live-in, and he stayed with my client for the duration of her life, which was about 2.5 years. So when we finally, after all these trials and tribulations, were able to make it work, and she was able to stay in her home with live-in care. So I think it's, it's asking the agency for references, interviewing them. I tell families that, again, since COVID, a lot of agencies are not doing this as much, but if somebody wanted to interview the potential caregiver, I ask the agency to bring 1 or 2 caregivers to the client's home. So the caregiver and the client have a chance to meet each other. They can each ask questions and then see if it's a good fit. If it's not a good fit, I expect the agencies to work to resolve it. That is a benefit of working with an agency, is that you have a bench to draw from. So, you want to ask, when you're interviewing agencies, how many caregivers do you have on your roster? What counties do you have a strong presence in the county that I live in? Can I get some references? What do you do? I can just, in way of screenings, what oversight do you provide with the caregivers? I'm trying to say, can the caregivers drive? Sometimes that quite often comes up, especially if, people are not in Center City. Do your caregivers drive clients' cars? Some agencies do not allow that. Some agencies do not allow clients to travel in caregivers' cars. So that would be something you'd want to find out. You'd want to double check to see if there's overtime on the weekends, if it's a different rate, and then what type of caregiver are you getting? A certified nursing assistant, a home health aide, because that's going to depend on, can they do Hoyer lifts if that's the need? So some agencies do not do lifting. If there's an animal in the house, you want to make sure that the agency or caregiver is aware of that. Are they comfortable with the animal? Sometimes it's not really in their realm of responsibility, but quite often the caregiver will end up looking after the animal as well. That's kind of an unwritten, but you want to make sure that they are comfortable with that if that's the situation. And then how they handle, if somebody is fortunate enough to have long-term care insurance, will the agency submit invoices directly to the long-term care insurance company? Because otherwise, typically what happens is if someone does have a policy, they will pay the agency directly, and then the client will send their invoice into the long-term care company for reimbursement. So it's kind of a process. What I like to see is that, if the agency will send their invoice directly to the long-term care insurance company, the home care company will send their invoice to the long-term care insurance company. So the client doesn't have to do that extra step. So little, office management, how that's handled would be important to find out if you're working with long-term care insurance. For private caregiver checklists, you want to ask them, definitely you want to get some references. We recommend doing background checks. That's pretty easy to do. You can do a state background check. There's a website I could share the link to where you can run a state and a federal background check on the potential caregiver. You can also do run on their driver's license to make sure that it's valid and they don't have any, speeding tickets or any other issues that might come up. You want to find out, if they're comfortable with, if it's a dementia or behaviors, if they've had experience in working with somebody with, different situations or illnesses that your loved one is contending with. You want to make sure that you're comfortable with communicating with them, that, they are willing to take calls from family members or care managers, that they're kind of a team player. If you have several caregivers in place, I've seen where there's a pecking order where one caregiver will kind of take over or feel that they're in charge or throw the other one under the bus. So you kind of have to really, work, and there's, I can talk about some ways to help manage that. But that can be a challenge, how, so when you're interviewing, you would want to say, have you worked with the team? Have you worked with other caregivers? How did that go? What's your style of communication? Are you willing to do meal preparation? Are you willing? I mean, they're supposed to do this, but I have seen folks that say, like, that's, not my job, or, I'm not going to, um, when I go to a doctor's visit, report back, because that's really not my role. I will take the client to the appointment, but I'm going to sit outside because I don't get paid enough. Like I have, so you can tell pretty quickly, I think, if someone is going to, what type of personality they are and what they're willing to do, or not do. Laundry, they're not supposed to do heavy, cleaning or lifting, but, they should be able to do, light housekeeping, running the dishwasher, things of that nature. So just, when I'm going to get ahead of myself, but when we're working with caregivers, I tell families, I think, you want to almost create a job description, right? So, or like the agency was to do a plan of care, but their plan of care is usually one page where the caregiver puts a check in a box, that they helped somebody take a shower or that medications were taken. So I tell families, like, you really want to kind of drill down and write the specifics. So, if your loved one likes to sleep in and doesn't want to get up before 9, but when they get up at 9, here's what they like for breakfast. And, maybe there's a pill that has to be taken 30 minutes before the meal. And then, they like to read the paper alone. They don't like to be bothered, and then, they have maybe a physical therapist that they're working with, that the days they're not going to therapy, there's exercises that the therapist would like them to do. So, kind of, if you can create, like I said, a job description, or even, weekly, Monday through Sunday, kind of what the days would look like, with the understanding that there's always going to be, modifications, but it would help them in their role. So you're not finding somebody, sitting on the phone, or snoozing or saying, well, I didn't know that was my job. Which I think that leads to frustration on both ends. So the more prepared you can be upfront, the better. You can definitely have the caregiver be part of the, the process when they start of creating the plan of care, and having them review it and make sure that they're comfortable with it and that they know what the expectations are. It's not an easy job, caregiving. So I think, being supportive and mindful of their needs too is important. And letting them know that you're there, or that you have someone there. I mean, the agency is supposed to do that, but sometimes caregivers said they really feel like they're kind of on an island, that they're helping this person and there's no one really supporting them. Again, that's, as a care manager, a lot of what we do is working with the caregivers to make sure their needs are met, and that if we see any situations that are brewing that maybe the family or we don't see because we're not in the home, that we're aware of the issues before they become more serious. Another thing I think that is helpful is when you're working, a caregiver is deciding who will be the point of contact. So I've had, families where there's, 4 or 5 children, and, some live out of state, some are local, some aren't always seeing eye to eye, and they're calling the caregiver and they're saying, tell dad he's gotta, get to bed by 8. And then, maybe the daughter's saying, he, don't listen to him, he's fine. And you follow my instructions. So kind of working out who is the point of contact. That's usually the power of attorney. And hopefully the power of attorney is set up. If the individual, the power of attorney, lives out of state or maybe isn't able to fulfill their role, then you want to find out who should you speak to in lieu of them. What is the format of communication do families like? We have caregivers. There was a great app that is no longer, but it was designed for caregivers to communicate with family members, because a lot of the caregivers will use a journal, right? But the journal or the log stays in the home, and it's really meant for, the different caregivers coming in to read, how Mrs. Smith did. But that information isn't shared with the family or anyone else that's not in the home. So, then you have to be mindful of HIPAA too, right? You don't want your information floating around, via email or, other formats that might not be HIPAA compliant or safe. So, what we do, we have used, Slack. It's an app that, can be shared with multiple people, and you can create different channels. So we have one client, her stepdaughter is very tech savvy. So she set up where we have a medication channel, an appointment schedule channel, different channels that we can set up and put in specific information. We don't use names because of HIPAA, so we'll use initials. But that's one way. And this family has family on the West Coast, family in New York, family in Atlanta. So they're spread out. So the caregivers can in real time say, saw AL today, or was with AL, and we went and got her hair done. She was a little cranky in the morning. She took her medication, so that we can get, and then we can ask questions in live time too. And then you have the feature of like almost doing a FaceTime call. Another way is just the typical, like, text, we set up a group text exchange. So if there are updates or things going on, the caregiver can let everybody know. And there's other different apps that I could share too, but these are just some of the things that we use. Let everybody know what's going on, and then, maybe the son can write back, well, what time did the appointment get moved to? Or, oh, the plumber's coming over at 3, just giving you the heads up, rather than using the paper journal. That's great, but, again, you're not getting that information in live time. Another piece that comes into play is how do the caregivers work with the other disciplines that might be coming in the home, like the physical therapist or the occupational therapist or care managers or hospice. So, making sure that I think everyone kind of operates in silos, that making sure that communication channel is flowing. And, if the physical therapist is recommending a change, maybe in the way the caregiver gets the client out of bed, or, wants them to do some exercises, that piece of information gets shared with the whole team. If you have multiple caregivers, coming into the home, you want to make sure that you have some form of communication channels set up, so they know, what is expected of them, or any changes that are recommended. A lot of times, it's old fashioned, but we use one of the big desk calendars because it has big boxes. If somebody has multiple appointments or might have some memory impairment, and, they need to see who's coming in on what day, it allows for enough space for you to write down any appointments and any professionals coming into the home. Anywhere it has a sidebar where you can make reminders, or, including appointments, or, don't forget to brush your teeth, or whatever, you want listed on the side. So that old-fashioned calendar has proven very helpful in a lot of our clients' homes. So that's, and I'm talking quickly, so I don't know if there's any questions, or if I didn't cover anything, I'd be happy to expand upon anything that somebody might want to hear
Liz,
more about.
we do have some questions in the chat. Do you want me to feed some of them to you now, or do you want to wait?
Yeah, no, that, was fine.
Okay. So one question is, how do you deal with tax withholding and workers' comp if you're hiring a private caregiver?
So we have, when we have clients that do that, we have actually an accountant that we have, you can choose any accountant, but we have an accountant who can set up payroll. So if you have an accountant that, you can ask if they could handle payroll, or, I could give you the name of the gentleman we use, but he in the situation, so where we have families using private caregivers, he has set up payroll for them. So he handles all the withholdings and then does weekly ACH payments. And sometimes families will set up, there's another family where they have a separate account that they put money into the account. And that money is to cover the cost of the care for the caregivers. So the accountant draws from that pool, that account.
Got it. Okay, and then a question about one of the kind of downsides that you've discussed about having a private caregiver, but what do folks typically do if they have a private caregiver and that person gets sick or can't come in on a given day? How do you set that up? Like, do you have a backup caregiver, or how do you typically handle that?
So a lot of the private caregivers we work with, because that's definitely a problem. So we prefer working with private caregivers who have, like, they kind of amongst themselves have created a little team. So I'm thinking of one client where there's 3 caregivers. So they make their own schedule. And I and the family said, look, we don't really, care who's working on Monday as long as it's covered. So if someone needs to take a day off, they can. But if you have a solo private caregiver, you do run that risk. So what I tell families is you should have a relationship with a home care agency. The agency is going to want you to complete paperwork and come out and do an assessment. And depending on how, like thinking of another family, they have private caregivers. Then the husband fired the caregivers. So we have a home care agency, kind of on backup. So the agency has the paperwork completed. They've done the assessment. So there's no one in the home right now, but if the family needs an emergency care, they can pick up the phone, call this agency, and hopefully they will be able to send somebody out. So you can have arrangements with the home care agency kind of as backup.
Thank you. Some folks are asking if you can share the resources for the background checks, and I think you're going to email those to me to email out to the group, right?
Yep.
Okay, so Liz is going to send me those 2 forms that she talked about and also some other resources she's mentioned, and everyone who's registered today is going to get that in an email from me when the session is over. Okay, thanks for the thumbs up. Liz, we're also getting a few questions. They're a little bit different, but I'm going to kind of summarize the gist of them. Is how do you recommend introducing a new caregiver into a home, particularly if the person you're caring for does not really see the need for a caregiver and is maybe a little bit resistant to the idea of bringing someone in?
That's a challenge, and it happens quite often. So I tell families a lot of times, if an individual doesn't feel that they need help, right, that they resent having someone in the home, or they don't feel they need the help, that sometimes, adult children have been able to say, well, look, Dad, you're fine. You're right. You don't need help, but this gives me the peace of mind. I can't be there all the time. Can you do it for me? Because I'm really, worried about you and, up all night, concerned, but knowing that there's a caregiver in place gives me the peace of mind. So that's kind of taking the focus off the individual. Another, if somebody doesn't like the word caregiver, you could say this is, a companion, or this is going to be your assistant. We never want people to come in scrubs. I think that's very off-putting for most people. So we ask caregivers to just come and dress normally, and maybe kind of start out small. So maybe the goal is, somebody needs help with showering. Well, I think coming in on day 1 and trying to get someone in the shower doesn't work well. So you build up a relationship. So maybe they just start out small. Maybe it's finding if there is something that the client needs help with and that they would permit the individual to do. It might be laundry. It might be sorting through mail. Maybe you start out there and then hopefully build a relationship and have them get accustomed to having someone in the home. And if it's not a good fit, again, like you don't want to try to, put like a square into a peg, that you can, find a better fit. But I think trying to take the focus off of the individual, that it's not so much them needing the help, that they're really doing you a favor for bringing in the care, and then maybe just starting out small with gradually building up to more, you know, hands-on or responsibilities.
Great. Yeah, I usually suggest that maybe the first few times the caregiver comes, the family caregiver actually may stay home for a little portion of that to make it even more seem like the caregiver is there for them.
Yep.
Um,
I just want to add, Allison, to that point too, if you're bringing in another caregiver, if there's an established caregiver, I think it's great to have some shadowing where the
mm,
caregiver or caregivers would work together, you know, for a day or for several hours, so they learn the routine and allow that introduction to take place while there's, you know, a known entity there. So
great. All right, that Liz, the questions are rolling in, so I'm just going to keep them coming if that's all right with you.
sure.
All right. Okay, I'm just going to read this one. With a spouse with mild cognitive impairment or MCI and wanting to simplify our lives now, what is your opinion about moving into a smaller home with less maintenance versus staying where you have lived for 34 years? Is it reasonable to expect someone with MCI to adapt to a new home, or will they be happier with the familiar home environment?
You can probably chime in on this, but so
Yeah, I have my own thoughts about this, but why don't you share?
I tell people, I think, like, you know, change is hard for anyone. And I think we're all creatures of habit. And I think especially someone with memory impairment, when you take them out of a familiar routine or environment, it can be a little topsy-turvy. But I think the longer you wait, the harder it is. So it's kind of like pulling off that Band-Aid and, you know, especially it sounds like if you're downsizing and, you know, as a caregiver, you know, like if you're dealing with home maintenance of a larger home and all that can go wrong and be required of you to maintain the house, if you can help minimize those other extra challenges in your life and focus on, you know, making your life easier. And I would say make that move sooner than later if that's something you're considering. That would be my opinion.
Yeah, I totally agree. I mean, I think also, and I'm sure you would agree with this, Liz, there's not a right answer, a right or wrong answer. It's a very, very individualized, but I agree that if you're going to make a change, the sooner you make the change, the more likely that person is to be able to sort of compensate and adjust. You know, this person doesn't say what the underlying disease process, but underlying their spouse's MCI is, but if it's a neurodegenerative disease like Alzheimer's disease or Lewy body dementia or something like that, what you want to think about in a really large home is also things like, are there lots of stairs? Are there lots of different bathrooms? Are any of the bathrooms accessible? Are any of the bathrooms on the same level as a bedroom? So thinking way, way, way down the line, which might be hard and uncomfortable, but when you have someone who's needing total care, some more care than they have now, is it going to be realistic for you then to be in that huge space? Is what I would think about. Okay, Liz, is it industry standard? This person says they live in Center City and parking is $12 a day. So it's hard to find someone to accept a position. Is it industry standard to provide parking or to compensate a caregiver for parking?
So, I mean, I'm surprised. So most of the caregivers that we work with are thrilled when there's a job in the city because they take public transportation. So I guess, no, we don't usually in my experience, most of the caregivers that we work with in Center City take public transportation. They do not park for that very reason. But if you love your caregiver and you think it's, then I would say yes. You know, if they're, but typically I would say that's not industry standard to pay for parking in Center City.
Right. What are your thoughts on setting up webcams in the home to make sure, this person says, to make sure nothing untoward is going on?
So I've had families that I think, you know, you're not supposed to record, right? Have audio in the home. So I think that's just to be aware of that. I have had clients, you know, I guess it's a mixed bag. So I've had caregivers be really resistant to the idea and resentful. But you know, I tell family members, if that's something that you feel you need to have, and especially if somebody's not able to communicate, if your loved one isn't able to express what's going on, then it's okay. If that, so, I think it's a personal decision, but, I've had families that have done it. You know, it has, there was one gentleman who was kind of monitoring. So the caregivers, it was hard to keep caregivers because he was almost like a hawk. So
Mm.
they weren't, they just felt it was like very Big Brother-esque. But, I think if you treat it that it's there and then, they kind of go about their day and, assume there's no reason for them to worry about having a camera, it's fine. But if you're, kind of nitpicking and say, I noticed that at, 12:04, like, mom was still in the chair and then she didn't have that, that can be problematic.
So it sounds like you're also saying that the caregiver should know that this is there, just to clarify.
Absolutely. They need to be told it's there, I believe. Yes.
Yeah, I agree. Okay, someone is asking for your thoughts on the decision between bringing in home care. I'm guessing this is sort of earlier on in a disease progression versus moving to a continuing care community, and the kind of pros and cons.
So that's a tough one. And I think so continuing care. So I guess if someone is hoping to get the life care kind of where you buy in and you come in independent, is that what, and you lock in your rate? You definitely want to move sooner than later. And, mild cognitive impairment doesn't always preclude someone for being eligible for the life care plan, but the longer you wait, if that's what you're trying to do, you would want to move sooner. If you're looking at paying month to month and you don't need the life care or want the life care plan, then you can stay in the home a bit longer. And just, but I do feel that, going back to the question about downsizing, that the longer you wait when someone has memory impairment, the more difficult it is for them to establish routines. So I think initially that move would be problematic. But the hope would be that they would have, be not that far along in the illness that they could develop a new routine, a new pattern, and enjoy some time in the new community. And I think it frees up the spouse, the caregiving spouse. But I think that change is really hard for a lot of people. But I guess so I'm answering, like, if you're hoping to get the life care, I would suggest that you do it sooner than later.
Yeah, I just spoke to someone yesterday who his wife is in a pretty progressed, I would say almost severe stage of Alzheimer's disease, and he was asking, now he feels ready to move into a CCRC, but his idea is that the two of them would live in independent living together, and the community is just not going to allow that. They're going to require that if they want to move together, he lives in independent living and she lives in memory care or assisted living, which is not what he wanted.
But I have seen in the flip too, some places have said that they would allow the well spouse, we call it, like, to stay with the person need assistance but that person is not going to qualify for the life care,
Right.
But they can bring in care. So I think it's it depends on the facility, the community.
Yeah, absolutely. It's very community dependent. Okay. Here's a few more. If you have long-term care insurance, I'm guessing they mean, and you are paying your private caregiver by check, is it the responsibility of the caregiver to do her own taxes?
So they would be an independent contractor?
Yeah, but they're paying, it looks like they have a long-term care policy insurance. And maybe the person who wrote this in can clarify a little bit. It looks like they have a long-term care policy insurance. They're paying the private caregiver as an independent contractor by check, and then probably getting reimbursed by the long-term care policy.
So we've done it two ways. We've had independent contractors where they've just done I think it's a 1099, the accountant. So they're not doing any withholdings. They just, but at tax season, they give the caregiver a 1099. So then it is up to the caregiver to, when they file taxes, share that right on their tax returns. And then the other option is, like I mentioned, with the accountant, is doing the withholdings. So I think that's kind of a what family specific, or what they prefer to do too. But you would want to give that individual that you're paying a 1099, have an accountant. And then make sure, because if you're doing any type of, you know, like Medicaid, if you're in that situation, you'd want to document everything that you've provided, or that you've paid for care. So if you're writing a check and not, keeping good records, that could, be problematic too, so.
Great, thank you. Liz, what are some green flags as opposed to red flags that if you were, say, interviewing a caregiver to come into the house that you should look for it during that interview process that would make them really good candidates for a job?
I think you could, demeanor is it, and then, asking, what their experience is, are they, I mean, do they show up on time? Are they, friendly? Are they, if, yeah, and some people say, yeah, I can do this, I'll do that. But definitely getting references. I think, how they interact with your loved one is important. And kind of just that vibe that you get. Let me just look at my questions too, to see if there's, that we like to ask. Yeah, if they're willing to do kind of the extras too. I think if you need help with the driving, or I mean, I've had, and it's fair, because they've said, no, I'm not going to do that, or I'm not comfortable with that. So I think that kind of, if that's like a need that you have that someone's not willing to do, you'd rather find out right away. But I base a lot of my experience on gut, to be honest. And then, I've been proven wrong, but I think you can tell a lot by, how somebody communicates and, interacts with your loved one. I don't know what just happened.
Someone is due. Let me see if I can turn this off. Okay.
But the checklist, I will give you the checklist too. So I
Awesome.
think that will be helpful, I think, when you're interviewing, to kind of rule out, or, make a determination if someone's a good fit.
That's great. I'm not exactly sure who this person is in relation to this hypothetical, but there's any guidance for managing objections from spouse of identified patient. In other words, it's a husband who believes he's managing care and household, doesn't want strangers, quote unquote, coming in, but the adult kids do see a need for it, and they're reluctant to confront him.
Okay, so the spouse is the husband and he's caring for his wife.
Yes.
Okay.
And then there's adult children that seem to think that he needs help. He needs more help at home. Maybe something's not going right, but they're reluctant to confront this.
The children are reluctant to speak with dad about this.
Yeah.
I mean, quite often that's where I think the role of a social worker, or trying to get everyone around the table and kind of hearing everyone's concerns and objections, is helpful. And I mean, I think sometimes children, they're feeling guilty, they're not there. So, there's situations I've seen where dad does have it under control. And the kids may feel guilty, and or just want to kind of layer everything on because they're not there. But more often than not, I think they see that the spouse, their father, might be struggling. So they could say, dad, we're worried about you. Kind of turn, again, it's not about you and your inability to meet mom's needs. It's about us. And we're concerned, and we love you. And, just pointing out that, if something happens to him, as the caregiver, which quite often can, I mean, we all have heard about caregiver burnout, or sometimes the caregivers are the ones that end up becoming, in the hospital. And then what? And then what happens to that dynamic if he's playing the primary role of, as caregiver to a spouse? So maybe that bringing a little bit more extra care will enable them to keep their independence longer, by allowing him to recharge his batteries and have time for himself and support.
Yeah, I agree about, also having a meeting with a family therapist or a social worker to navigate these discussions. But I also tell adult children, also know your boundaries. So ultimately, your dad is the POA, he's the spouse, he's the decision maker, and you have to decide when sort of enough is enough pushing for you, and when you're going to say, I'm going to take a step back, because I can only do so much if he's not willing to meet me halfway. and I'm going to help out and maybe, take my mom to chair yoga 2 times a week and do what I know I can do to improve her quality of life while not continuing to be in this locked horns battle with him.
Yeah. Yeah, and then we tell families that's like, people have the right to make bad decisions. But we also, if someone can maybe take over bill paying or set up auto pay for dad, or what are maybe to have groceries delivered, other things that might help kind of lighten the load, but not necessarily bring in more care. Maybe have someone mow the lawn, other areas that you could support.
Yeah.
Your family with.
Liz, you might want to check your chat as well, since we're co-hosts. Some people might have sent questions directly to you. Do you have anything in there?
What are your thoughts on nanny cams? I think we spoke about that, right?
Yeah.
If you're having long-term care. So yes, I mean, if you're paying long-term care and you're paying your private caregiver, I answered, yeah, they are supposed to do their own taxes, and you could give them the 1099 and then they're supposed to claim that on their, and I can share, if you would like, the name of the accountant that a lot of our clients use too, because he's familiar with the different options. What is cost for private care for nights only? That person will sleep at house or spend only if needed, rarely occurs. So if we're going through an agency, they don't care. They're not going to say, oh, we have it. Like if you're sending someone overnight, it's considered a wait care. And a lot of these caregivers do when they're overnight nap. So it would be the same hourly rate. And there's not a differential between usually, day caregiving and night caregiving as far as the charge. So you'd be looking at, what did I say, like 20, 27, 35, like in that range. If you hire a private caregiver, that's up, you can, work out the details with them directly, so, but I think most people, like we do have cases where, there's live-in caregivers, they're private caregivers, they get paid a flat $100 because the client's not getting up. So they get $100 for overnight, but during the daytime, they get paid an hourly rate when they're actively working. So that would be worked out, directly with the private caregiver, which I think you would probably, if the person's sleeping and you just really need someone there, I would say that might be a good time where you use a private caregiver.
This might be more of a question for an accountant, but I'll volley it to you to see if that's not the case. If I want to deduct tax, I'm assuming on that person's personal tax returns, for paying individual caregivers for dependent care, do I need to issue a 1099 to those caregivers in order to do that?
I would say you would probably have to, yes, I think, I'm not an accountant, I think that would be more of an accountant question, but I would imagine that you would need to show if you're like I mean, other than just a check, because the IRS will probably want something more tangible, but that would be an accountant question, so. Unless you know, Allison, I don't know.
I don't know. I think that's a question for your accountant. Yeah.
Yeah.
Believe me, no one in this Zoom wants my financial advice. Okay, this is the last question in my chat, but there's a few that are sort of getting to the heart of this. Is, let's say there's sort of conflict with your caregiver. Let's say it is a good fit with your caregiver. You like them, everything's going generally okay, but they do something that you don't like or that you want to change, and you're having a hard time talking to them about it or sort of confronting them about it because you do really like them and you don't want to scare them away. How would you negotiate or navigate that type of conversation?
So that definitely has come up. So I guess it depends on where that caregiver is coming from. If they're with an agency, when that does happen, is we usually contact the agency. We kind of share with them what the concerns are. And then they would usually send a rep out and have a meeting with the caregiver and the family, and see if there's a way that, things could be worked out. Maybe a caregiver is feeling resentful that they, or whatever the issue is, it would be usually between, again, if it's the agency rep and the individual. If we are involved, that's a lot of what we do too, is kind of finessing, and kind of setting expectations too. Like I have one client, this caregiver is amazing, but she showed up with a dirty shirt and he was ready to fire her because he said, I'm very, hygiene and presentation is very important to me. So he actually did fire her. I'm sorry. She was on her way to the house and he called and told her not to come. So I had to do damage control, and I was like, time out. I'm like, if this is, is she showing up on time? Is she, being kind to your wife? Is she, capable? And he said, yes, yes, yes to all of those things. So I said, well, maybe she was having a bad day. Maybe we don't know what's going on in her life that, she didn't have time to change her shirt or spilled something on the way over. I don't think that's, reason to, let someone go. So I think it's expectations, managing the expectations, right? And I think it's, it is almost like a relationship, and you're with someone, no one's going to be perfect all the time, but if overall things are going well, I would say that you should try to sit down, share what your concerns are, listen to what the caregiver's concerns are, and hopefully reach a resolution that may or may not involve a care manager or a therapist or a member from the home care, about, the home care agency team. But keep them if at all possible, because it's hard to find, good, solid caregivers.
Yeah. Yeah. So I think that's a good message too, right? It's kind of a rough industry right now, especially post-COVID. So finding someone who's great is a gem and to be treasured. Yeah.
Yes, I would say absolutely. Yeah.
Liz, that's all the questions in my box. Do you have any more in yours?
I don't think so. No, I had the 3 that we talked about.
Okay. Let's say final call for questions that you can send in the chat.
Or anything I didn't cover that people would like me to discuss.
All right. Well, while folks are taking some time to write some questions, I'll give some brief announcements before we wrap up. So this is a monthly session that we do, Empowering Caregivers Workshop. Sorry about that. So we have dates coming up in March, April, and May. These are always available on our website, penmemorycenter.org. On the top navigation bar, you go to Programs and Services, and then to Empowering Caregivers Workshop Series. This is also where we upload recordings of the past sessions. So next month, March 22nd at noon, we have our very own Lisa Walk. Dr. Walk is the Director of Geriatric Medicine for Penn Medicine, and she also sees patients 1 day a week at the Penn Memory Center. And she's going to be talking about clearing the air on medications used to manage dementia symptoms. So understanding the types of medications that we commonly use to treat behavioral symptoms that arise as a result of dementia. So I think this is going to be a really interesting and informative talk. In April, we have Patricia Quigley of Laurel Hill Funeral Home, who's going to talk about funeral and life care planning in a way that makes a lot of us really uncomfortable. She's going to do so with humor and honesty and talk about all different kinds of faith traditions and belief systems. So I think this is also going to be a really great program. Yes, to people asking me, you will get email notifications of the lectures. We send them out about a week ahead of time. You can also go on our website. Okay, Liz, quickly, 2 more questions. One, how often are caregivers hired into assisted living facilities? I'm guessing if that means someone who is a resident of assisted living facility and the family also hires caregivers. If you could confirm who asked that question. How do you balance the team, I guess, between the hired folks at the assisted living and your private caregiver that you've hired?
So I guess going back to just since COVID, is I preface everything. A lot of assisted livings have been bringing in agency caregivers. We've seen that a lot, and I think that's a disadvantage because people move into assisted living facilities because they want continuity of care, in my opinion. So you have a lot of agency caregivers coming in, for a shift or a day, and so they might not know someone's routine, and that person doesn't know them. They don't know the caregiver. If so, that's one. I don't think that answered the question. I think is if someone is living in a personal care assisted living setting and they have a private companion, that companion or caregiver is not supposed to do hands-on care. So they can go get the staff and they can say, you know, Mrs. Smith needs help with XYZ, or you know, they can do companion care, they can, you know, do laundry, but they're not supposed to do hands-on care. If somebody's in a facility that's in independent living sitting, that's a continuum, but you bring in a caregiver on the independent living section, they can do hands-on care. But if you're in a personal care or assisted living setting, a private caregiver is not supposed to do any hands-on care. They are there to serve as support, eyes and ears, and then go get a member of the team at that facility if their client needs any hands-on care.
Great. All right, I think that's it. I want to give a big sort of virtual round of applause to Liz and thank her so much for coming and sharing her time with us today. Liz, do you want to shout out your website or your practice or anything that I can share to folks, which I'll also share in an email after this?
Sure, and I'm happy to follow up and answer any additional questions. So our practice is called Kith, K-I-T-H Elder Care, and we are a group of social workers and a registered nurse who provide care coordination. Most of our clients want to remain in their homes, so we help, you know, really it's concierge care, whatever they need, be it getting home care in place, being an advocate, taking people to doctor's appointments and sitting in and taking notes and then sharing a visit summary with family members. We can help with insurance questions. And then if somebody can't stay or doesn't want to stay in their home, we help with placement. So we know we cover Philadelphia and Montgomery counties primarily, but we know a lot of the resources in Delaware, Bucks, and Chester as well. So we service those areas, and I'd be happy to answer any questions about our services if people have them. And then just in general, if you needed a resource, I'd be happy to share, you know, if we're able to help. So
Thanks so much, Liz.
thank you. Thank you.
Thank you everyone for coming today. Again, I'll be emailing out the resources after we finish up. And you will get an email when the video of this is available on our website. But all of the past recordings live on our website, penmemorycenter.org/programs and services/empowering caregivers workshop. So thank you all and have a great weekend.
Thanks, Allison.
Thanks, Liz.
Bye.
Thank you very much. I appreciate it.
Thanks.
Thanks. Bye-bye.